Let's talk about educating our patients on their own bodies and hearing their stories so we can better understand what's going on in their bodies. As a clinician and a pelvic floor physical therapist, we see this time and time again in the clinic. Our patients are coming in, they're having pain somewhere in their body, and they really don't know either where it's coming from, why it's happening, or why they're not getting better when they're trying things like Pilates or acupuncture or other physical therapy, and things are not changing. I'm Dr. Alexa Charbonneau, pelvic floor physical therapist, and I'm here today to talk about why educating your patients and hearing their stories are so important to their plan of care. I have a patient who's been coming here for about 6 months for pelvic floor physical therapy. And I remember on her first visit, she had a lot of questions about why is her Pilates not helping her get better. Now, we went through the story, we went through her history, and she has a lot of pelvic pain, typically around her menstrual cycle. And we started to unpack all the different systems. We treat in our clinic with a systems approach, meaning we look through every system in the body. We're looking at the musculoskeletal system, the nervous system, the lymphatic system, GI system, cardiovascular system, right? There are so many pieces to this puzzle. But once we started to realize and actually look at the way she was doing Pilates, I noticed that she was clenching her pelvic floor and tightening it every time she tried to engage her core. So much so that it was actually affecting her by causing her pain a couple hours later, difficulties with bowel movements, worse period pain, back pain. Now, as I educated her and actually pulled out my pelvic model to show her the attachment points from the pelvic floor muscles back to the back and to educate her on that connection from the diaphragm to the pelvic floor and the associated muscles in the middle, she had a huge aha moment. Oh my goodness, I didn't even know these were connected. Her Pilates instructor was great, but her Pilates instructor did not even connect those dots because she wasn't thinking about the anatomy of the pelvic floor. Now, as soon as I brought that image to my patient with a 3D model, I had her touch it on herself, I had her feel it on herself, everything changed. That is when her symptoms actually started getting better, and it was a huge shift for her. Then when she went to her Pilates class and actually did something that she enjoys doing and she has the autonomy to do, she was able to feel it in real time as her pelvic floor muscles were letting go, and she then started to use the proper muscles to stabilize herself. I want this to be a reminder to clinicians. When your patients come in the door and they have something going on that you're trying to help them figure out, ask them to explain their condition in their own words and use their story and their words to help guide your assessment. They are the ones experiencing the pain. They are the ones experiencing what's happening in their body day to day, and they're the ones that know how to make things better. Once you start to ask these questions to your patients, that's when the shift happens. Your patients are more engaged. They want to come to PT. They want to do their home exercises, and they want to be involved in their care. We as clinicians and pelvic floor therapists, our job is to help guide the patients to heal themselves. They are the ones with their tools, and we are just giving them more tools and helping them feel this themselves. And once these patients feel more confident and they're able to do this without as much guidance from us, that's when they get better, and that's when they get back to doing what they love. I want you to remember, educating your patients, hearing their story, asking them the right questions, and being involved in their plan of care are huge, important things for their plan. If you find this information useful, throw us a subscribe. We love educating other clinicians and patients in our community, and we are happy to share this information. Pelvic cheers!